Well, good afternoon, everyone. Welcome to the Standing Committee on Human Services. My name is Ken Cheveldayoff. I'm the MLA for Saskatoon-Willow Grove, and I will serve as your chair this afternoon. Committee members are Mira Conway. Substituting in for Mira today will be Doyle Vermette for the first hour and Matt Love roughly for the second hour. Also committee members Ryan Domitar, Mohammed Fayez, Derek Myers, Hugh Nerleen, and Alana Ross. Today, the committee will be considering the estimates and supplementary estimates number 2 for the Ministry of Health. We will now begin with vote 32, Health, Central Management and Services, subvote HE01. I would ask officials not seated at the table who wish to speak to take their place at the table prior to speaking, and please introduce yourself if you're speaking for the first time this afternoon. Ministers, over to you. Please introduce your officials and please go ahead and make your opening remarks.
Thank you, Mr. Chair. I don't have any opening remarks other than to welcome my team back for the final 2 hours of committee, and very much appreciate Mr. Vermette's joined us here today. I have Max Hendricks, my Deputy Minister, and my officials will introduce themselves when they come to the table. Mr. Hindley.
Thank you, Mr. Chair. Same here. No additional opening remarks, but just thanks to our officials for being here today, and to Mr. Vermette for the questions that will be coming forth over the next couple of hours of estimates here.
Mr. Vermette, the floor is yours.
Thank you, Mr. Chair. I want to thank the Minister and the officials for being here and giving me an opportunity to ask on behalf of constituents and, of course, many families who are suffering with mental health addictions and a suicide crisis in our province that's currently going on. And as I've been doing questions each day in the House, on behalf of the families, asking them, they need real action, they need a plan. And I know the Minister has said, and I thank him for coming to the North and meeting with our band councillor. And I was hoping, and I know I won't speak for the band councillor, but we were hoping in this budget it would be treated like a crisis when it comes to mental health and addictions. And the amount of money that we're spending in health, and then seeing the number go down from 7.5 to 7.3% of the overall health budget was not something I was really very happy to see. And of course, many others were hoping we have a crisis. So I just wanted, because I haven't had a chance to be here when you did your opening remarks, so I just want to give a little bit of background where I'm coming from and the questions I have when it comes to mental health, addictions, and suicide crisis going on in our province. So with that, I guess I can get into some of my questions. I've had an opportunity to meet with many families and have families share their pain. And they look at a government to hopefully help so that other families don't have to go through the same pain they have. And that starts with consulting, that starts with talking to families, frontline workers and stuff. And some of the challenges, what is your ministry going to do when it comes to the barriers that families are seeing in our province with a lack of services, ministries maybe not communicating with one another, and making sure, because there's barriers that they can't communicate for whatever privacy. I don't know what the reasons are, but they're being told they can't. Can you just give me a little bit of background why a family who lost a loved one would feel that, how is the government not dealing with these priorities of barriers? And is there anything that we can see help in your ministry with the dollars that are currently being put under health to make sure that there are no more barriers when ministries are working together, when somebody's reaching out for help? I know that there's a family wanting to have an answer, and it gives me a day to start here, and I just would start with that. If you could give us an update, that would be helpful.
Sure. Thank you, Mr. Chair, and thank you, Mr. Vermette, for the question. So just a couple of things here to touch on when it comes to the budget itself this year for mental health and addiction. So we're investing, as I've said before, a record investment amount into $470 million into mental health and addiction services in this year's budget, with a targeted $8 million increase for additional and enhanced mental health and addictions initiatives in terms of what we're providing across this province. And there's some new initiatives, but also some enhancements to some pre-existing ones here, and some annualization dollars here as well. And I've talked about a number of these previously, and some of them are the addictions treatment spaces. Some of it's the enhancement of to fund the ongoing efforts of the virtual PACT, the Police and Crisis Teams partnership that we have with RCMP. There's funds there for detox treatment spaces as well, and a number of different other areas that I'm sure we'll talk about here this afternoon. Specific to the question, though, about the barriers that families may be seeing across this province, you know, that's something that we want to improve. There should not be barriers to people when they're trying to access supports, whether it's mental health or addictions, when they're in a time of crisis or a time of need. And there's a number of different avenues that people can access, whether it's 811 or 911 in emergency situations. There's a number of mental health clinics that are available across the province, some operated by the government, some operated by some very, very good community-based organizations in this area. We do have some dollars in this year's budget, over $1 million, in fact, to support information technology infrastructure in mental health and addictions, and that's to better streamline and have clearer and more open lines of communication when it comes to the various services and supports that we have, the healthcare professionals in this province and in this ministry, and we know we need to better coordinate that as well with other ministries in addition to that. One of the goals of the integrated youth services model, which provided or received some initial startup funding in the last budget year and is going to have additional dollars committed to it in 2022-23, is to better align the supports that we do have. So, and that involves better coordination between ministries of health, mental health and addictions, social services, corrections and policing, education, any number of these areas of ministries or agencies where they have some involvement on these issues. And the integrated youth services model is designed to provide that sort of one-stop shop, if you will, for youth trying to access services and supports. And that is something that we want to be able to deliver upon across the province in terms of improved coordination of the existing services that are out there, that are funded by government, and making sure that it's easier for people to access the supports that are out there and not have to spend time navigating, trying to determine where they can find help. And in doing that, it also helps us to identify where there's some gaps. Sometimes there can be duplication of services, and I know I've heard that from some of the community-based organizations that I talk to in terms of the work that they do and the work that they provide. But there are also sometimes areas where there are some gaps. So being able to better coordinate these services provides it's a priority for us, and it provides sort of a twofold approach to it. One, it just makes it easier for residents across Saskatchewan to be able to access these services, but it also, number two, helps identify where we've got some gaps that we need to address.
Well, thank you for what you've shared so far, but I think, to be honest with you, I know the frontline workers. I know some people who do amazing work with mental health. I think back home, and I know many. I have 17 grandkids, trust me. I'm fortunate when we're reaching out, sometimes you don't have the resources, and I've been fortunate. I always say this, the Creator has provided me so that I can help my grandkids to get to an appointment for mental health, to make sure that traveling, that they can get those services they need. There's many families back home that struggle, whether they're rural, urban, you know, our rural areas, our northern areas, who struggle with getting to services. And the challenge is paying for it and making sure they have that in a timely manner. And that's what we talk about, the barriers. I mean, again, I'll go back to saying, I know that the frontline workers are doing all they can, but I also know some of them have said very clearly they're burning out too. And we know there's a crisis going on, and I've tried to express that, and we were hoping, you know, with one of our northern leaders coming, more have been speaking out, and I think our municipal leaders, we're hearing it everywhere we go, that there is a crisis. And we're hoping that this budget and the allocation of dollars that are here would have been improved. And I realize you say you give more money, over, you know, dollars, millions, 400 and some million. You talk about 8 million more when we have a crisis where we're losing so many people with COVID, with mental health, the addictions and suicide, and I see the list goes on. And I don't want to get into this point of arguing back and forth, of the overall budget, you guys have gone from 7.5 before, where it should be about 9%, I think, is we have said that, and we've heard people saying that's what we should be trying to deal as a target, but now we've dropped to 7.3 this year, from your numbers, if I'm correct. So having said that, well, we have a crisis going on. I was hoping, we passed a bill April 30th, a suicide bill for the province of Saskatchewan, passed unanimously in this Assembly. And I thanked you then, and I will thank members of this Assembly for doing that. It was the right thing to do, and we needed to do that. I've asked for questions who have been consulted. You had 180 days to consult, and I was hoping we would see in this budget some real effort and saying it is a crisis, let's treat it as a crisis. Let's consult with frontline workers, families, school divisions, municipal leaders, families who have lost loved ones. Let's sit down and have a dialogue and truly find it is a crisis, let's deal with it as a crisis. Just like I've said before, where you might have a flood, a drought, fires in the north, government takes resources and they put them in and allocate them to deal with the crisis. And when the crisis is over, they allocate those resources somewhere else. I was hoping and wishing that yourself and the government would have seen that as a crisis and would have responded that way. And I have to be honest, it is a struggle, and I see other families who are feeling the same struggles. So, you know, as I said, I thank the frontline workers. I thank those families and leaders who are calling out First Nations, Métis leaders who are saying we have a crisis, and they're hoping the government will respond. I would like to know what your plan is, and that's what I'll keep asking. What is the plan? How many more children, how many more citizens does this province have to lose with suicides, addictions, mental health? How many families have to come before this Assembly asking, saying, we have a crisis, we have a problem, how come we're not dealing with it? And I know we can sit down and talk, and I believe, and I want to say this for the record to you, I believe you when you say you're sincere. But, you know, I was hoping to see that the budget would have had more dollars allocated so we could deal with this as a crisis. And the Premier and the Cabinet would have seen it as a crisis. And unfortunately, I have to be honest, I'm waiting to see what's happening. But when I see the struggles going on and people leaving the field, whether they're retiring, and I got more questions, but on that note, I'll leave it there, and then I'm going to get into the questions that I need to have answered. But I just wanted to say that for the record, to just have a dialogue, because I didn't get an opportunity, and I wanted you to know that I am sincere when I say I want to work with the government. Yes, I can be stubborn and I can be a little miserable sometimes, but I understand it's because I have passion for the people that I support. Even my staff, who's lost his daughter, 4 little children, committed suicide not long ago. It's pretty tough, and you watch it, and you wonder why the supports aren't there when they need them. And I hear people saying this. All I want as a family is no more barriers, and when we reach out for help, please have the resources there. Know that we've done all we can as a family to bring the person that may need mental health or supports, that they get the supports that they need. and that they're there. And that's what these families are asking for. So I'll let you comment, and then I'll get into more of my questions. Thank you for taking my question.
Thank you, Mr. Chair, and I thank the member for the question and for his ongoing support and interest and commitment to this, not just for the constituency that he represents, but for people across this province. And I think that's something that each and every one of us in this assembly is committed to in terms of the work that we are trying to do for the people in our communities that we represent when it comes to suicide prevention and to mental health supports and addiction supports, and we can talk about the numbers and in terms of like the overall investments. And we continue to provide funding for our suicide prevention plan, Pillars for Life, which was released in May of 2020, and we've had several $1 million invested into that initiative and the additional initiatives that it supports. And we've talked about that before in the House and publicly, I think, through the media as well, in terms of what that means for improved psychiatric access to. For patients accessing some of these treatments, enhanced mental health first aid, and enhancing local suicide prevention projects, specifically for Northern youth. The work that we're doing with the FSIN through the letter of commitment that we signed with them back in September of 2020. Some of the initiatives that have been funded on an annual basis, or, as an example, on the one-time basis, funding we provided to the Muskwa Lake Recovery Camp, and had an opportunity to visit Pine House earlier this winter and meet with a group that meets weekly and to discuss suicide prevention and mental health issues in their community. And that's an example that of an area where that consultation happens, and it continually happens with me as the minister in terms of the portfolio that I'm responsible for and fortunate to serve in, and I continue to consult and hear from members on all sides when it comes to what it is that they are hearing and what they're recommending. The member for Regina Walsh-Acres and I have had some very deep discussions about this, and of course that member has very close personal circumstances, and of course, and I am very grateful for his work on this issue and raising it within our own caucus and government. But as we've talked about in this chamber, this is it's a nonpartisan issue. It's one that each and every one of us is trying to do as much as we can, and it truly is one of these areas where it's not a one-size-fits-all approach, and we have different challenges that are faced in different communities. north, south, urban, rural, First Nations, non-First Nations, newcomer communities as well, and trying to find what works. And we're always interested to hear from people across this province, whether they're elected or if they're the people that we represent, and hearing from people and hearing what those ideas are from those individuals. And I know that when I've had discussions with representatives from the FSIN, and I know that our officials have had discussions with folks from the FSIN, that that's the nature of some of the discussions they have, is bringing forward some ideas. We're always open to looking at what other ideas, initiatives that could possibly be tried or might be working on a small localized basis that perhaps are showing some excellent promise when it comes to mental health supports and suicide prevention initiatives, and showing some positive outcomes. So we continue to look for that support. We look at other jurisdictions, see what other provinces and territories in this country are doing. We look at expanding virtual care options as to provide for some additional options here when it comes to people who have, perhaps based on where they live, have difficulty accessing some of these supports. Put some additional dollars in this year's budget to further enhance and further expand the mental health walk-in clinic program, which has worked very well and will be expanding to an additional 8 communities. But we know that the conversation continues, and work is going to continue day after day after day on this issue, and knowing that it's a priority for provincially elected folks, but also municipal and federal and First Nations leaders and leaders within our own communities that serve on a number of local organizations that are trying to do their part. And I think at the end of the day, that's what we're all trying to achieve, is to work together and to try to provide the best possible supports we can for people in our communities as we face this challenge.
Thank you, Mr. Chair. I guess I'll go with my question. I'm thinking about when we talk about the Children and Youth Advocates' recent report stated that nearly 800 children were on a wait list to see a psychiatrist in Saskatoon alone, Regina. Current wait times, what are they? Do you have those, and can you please provide those for, if you don't have them, can you provide them for the committee?
Thank you, Mr. Chair. So we've got a few numbers here that we can report back to the member. So as of March of this year, March 2022, the SHA has advised that there are approximately 400 individuals on the wait list in Saskatoon to see an SHA child and youth psychiatrist. It's important to note that that wait list does not include the wait list of private practice that psychiatrists may have. Just generally speaking, though, in terms of what some of the current wait times are in the province, and these are as of this spring here, again, a snapshot in time, but in Regina, roughly a reported wait time of 3 to 4 months for child and youth psychiatric services. Prince Albert reports a wait time of approximately a month, and in Saskatoon, as the committee may know, that it's a longer wait time there of roughly 9 months for child and youth psychiatric services. You know, I think it's important to note that not every child necessarily needs a psychiatrist, but in these instances where we do have waits, and Saskatoon is, you know, the wait list in Saskatoon is definitely of significant concern for us, and I think it was my predecessor in this role, previous minister, that had written to the SHA, to the former head of the SHA, in terms of identifying that challenge and trying to determine a way that we're going to address that significant wait in Saskatoon. And as I understand it, you know, the work continues with the interim CEO of the SHA, and trying to do what we can to get those wait time numbers down in Saskatoon in particular, but across this province for children and youth that are waiting for psychiatric services.
Mr. Chair, just an opportunity to ask, I guess, looking at that, the bigger centres, and you're talking about, honestly, families who are waiting and children who are waiting to see whether, I don't want to be the one to say who should get there first, and, you know, if it's a priority or not. Those are alarming numbers that you're talking about to start with. But having said that, I think about psychiatric services available. You know, you look at 24 hours a day outside of the bigger centers. Is there anything, the rural areas, out of the big centers, the north, do they have access to psychiatric services 24 hours a day? What is the response to that? And can you just give us an update? Because I've had some people asking, and I'd like to give them some answers.
Thank you, Mr. Chair. So in non-emergent situations, there's always the ability and the option and would be recommended for individuals to go to their local health center. But in the case of 24-hour psychiatric support, province-wide, there's access to 811, and I can report that in the instance where there's severe cases, that the turnaround time in those cases, 100% of folks are taken care of or receive access to support within a 24-hour time frame is what has been indicated to me. In the case of a number of communities, for example, in Prince Albert and in North Battleford, there's a psychiatrist that's on call, and so if someone presents looking for, presents to an emergency room or is referred perhaps through as a result of a phone call to 811, there are psychiatrists that are available to provide some support, and that would be for individual patients that are making those calls directly, or perhaps if they present to an emergency room or to their local family doctor, the general practitioner, the family doctor, can also make those contacts as well and make a direct contact to the psychiatrist. But in terms of 24-hour, 7-day-a-week support, again, 811 is available there and can provide the direction and referrals as necessary.
Okay, so that's the 811. I know that, and I know this from seeing it, hearing it from families, from different people, the frustrations and alarm and concern and fear for their loved ones. Whether they're under the mental health, have to call police officers, the RCMP, the city police to respond to a crisis and somebody's mental health. What is the process and what is your ministry's role in making sure that those individuals are getting services, being assessed if they're being, I guess, brought to cells? And how's the process to make sure that somebody is suffering with mental health, and instead of just saying to them, well, we've done a quick call or an assessment and out they go, back out on the streets, and our municipalities are the ones that sometimes are dealing with some of the individuals who truly are struggling, and maybe for whatever reason, I'm no expert, but I just see what I see going on and the challenges I hear from families saying they can't understand why their loved one, they're concerned, and then all of a sudden they're turned out and they're let go free and without feeling like they were proper assessment done on them. I think we have a crisis going on there, so I'm curious to see how your ministry is dealing with that, and maybe the dollars in this budget are going to alleviate some of that, because it is a crisis, and I'm hearing there's quite a bit of concern around that. So I'll share that, leave that for you to answer.
Thank you, Mr. Chair. And I'll just maybe give a high-level view just of a couple of areas here, and then we'll ask Brad Havervold from the Ministry to get into a bit more detail in terms of what we currently do. In this year's budget, we have provided some annualized funding for the virtual pact, the police and crisis teams, a model that has been very successful for us. Not just the virtual pact, but also the overall pact program itself. So we've annualized the funding there just based on not only the results we're hearing from people that operate the program and those officials, but frankly from people on the ground in a number of communities that have seen the benefits of that particular program. And I think that is a valuable tool and a resource for us to have. There's some dollars tied towards the Drug Task Force and its recommendations or findings as a result of the work that it's done over the past number of months, and that includes the consultations that wrapped up earlier this fall that culminated in a final report to government. And as an example, one of the initiatives there that we're going to be pursuing in this budget year is this hotspotting approach towards a locally targeted type of mobile and flexible response type of unit that can specifically target areas where, and do so quickly and in a mobile and flexible and scalable way to provide supports in communities or areas of the province where we've got some immediate issues and be able to react very, very quickly. So those are a couple of initiatives, but I think I'll ask Brad maybe if he wants to comment further on those two initiatives, or I think there's some other areas there as well that we're investing some dollars into in the last year or two that will help us on this front.
Thank you, Minister. Brad Havervold with the Ministry of Health. Just to build on what the Minister was speaking in relation to the police and crisis teams, it was a few budgets ago now that teams were implemented in our larger centres, North Battleford, Prince Albert, Swift Current, Regina, Saskatoon, the police and crisis teams, marries a police officer with a mental health worker whose sole purpose is to attend to potential mental health related situations, emergencies, to help de-escalate the situation, and to direct that individual to the appropriate location that is most appropriate for the needs of that individual. And most often that would be to an emergency department or to their mental health team if it's during the day, or even making connections back to their local mental health provider for appropriate support. So, we do realize that I think cells is not the right place for people that are in those situations, and that's why those police and crisis teams were started. As the Minister mentioned, the expansion to include the RCMP is actually one of the options that allows that service to be extended into the north, where local RCMP officers can dial into a team of registered nurses that are on staff at the RCMP to assist them virtually in managing mental health cases, again, and with the goal of directing them to the appropriate location. Another thing that we've started a couple of years ago and is going to be resurrected now that we don't no longer have as many pressures related to the COVID-19 pandemic, a project called Health IM. It is a piece of software that is available to police officers in their cruisers that allows them to do a quick scan of the situation that they're experiencing, particularly those where they're suspicious of mental health related concerns, and it allows them to effectively triage whether this is more about a criminal behavior or whether it's a mental health issue, and allows that police officer then to connect with emergency departments and redirect people to the appropriate location. So it's another tool in the hand of police that may not be the exact police and crisis team. It was trialed in Regina with great success a few years ago, and we're looking to expand that out. And the final thing I might mention is We do have provisions in the Mental Health Services Act that allows for the detention of individuals for their own personal safety to have a mental health assessment done if a police officer believes that there is benefit to having that assessment conducted. So that allows an individual to be taken to an appropriate location to have that assessment done rather than, the first trip being to cells.
Well, I just want to take this, it takes me to, I guess, a further question. So you're saying the RCMP have the tool to be able to determine that that person needs to be brought somewhere else, or who is it that determines that this person, whether it's a technology they're using, whatever it is to provide them to determine whether this person is, should go to cells or maybe go get an assessment done. So you're saying if the place that does the assessment is full, where would they take them?
Thank you, Mr. Chair. Yeah, just to clarify and I think just explain how, what would happen in a situation like that. And that's where the PACT teams, the police and crisis teams, have been successful, because it allows for us, whether they are, if it's a PACT team and there's an RCMP member or police officer that receives a call or is attending to a call that is potentially a mental health situation, they've either physically, they have a nurse, whether it's an RN or a registered psychiatric nurse, with them attending to that situation, or in the case of the virtual PACT, where a police officer is called to a situation that may involve a mental health incident. They do have 24/7 on the line with them a nurse or a registered psychiatric nurse that can help provide that determination. So it's not, it's not specifically the RCMP officer that's left making that determination as to what's the best course of treatment for that particular individual. So that's where it's the team approach between the officer attending to the call, but either having a nurse or a registered psychiatric nurse with them, either physically on the call or, in the case of virtual PACT, on the phone with them to help make that determination as to what should be the next steps that are taken with that particular individual to make sure that they get the help they need, and of course would be then done in consultation with, depending on the community, what might be available or open at that particular point in time or that time of the day, whether that there is a facility or that individual can be taken to for further assessment and treatment and admittance, or whether it's an emergency room nearby. But that would be the determination made by the PACT team itself and the healthcare professionals that are partnered with the RCMP.
Well, again, I'll say again, thank you for clarifying that. And that's exactly what the problem is. It's fine where those teams are set up in the bigger centers. I realize that. But when you're in the smaller centers dealing with mental health, addictions, that puts it at a, I guess, I think it's, you like using this word, I've heard, there's more work to be done. And I'm serious when I say that. There is more work out there to be done. We do have areas where addictions, and I'm not going to go into a little bit of addictions, and here's why I want to kind of go into that area, but we can say programs are there working, and we can say we try our best. I get that. And I know frontline workers are doing what they can. And I do thank our service people, RCMP and police who do respond, and they try to do what they can. So, you know, on that note, I acknowledge that. But again, I go back to people struggling with addictions, and I'll be honest with you, I spend a lot of time having families, talking with people who do struggle with addictions. I struggle with my own family with addictions. As I've said, nobody in this world, you just never know who's going to struggle with mental health, and all of a sudden they're into an addiction, and unfortunately you're seeing the situation go on. When I think about addictions, and this is one of the questions I have, somebody reaches out to mental health and they say, I need help, my addictions. And I've said this, that I thank those frontline workers who are doing what they can. But until you actually help somebody navigate through that calls to try to get them help, a counselor, seeing a mental health worker, trying to get to detox, trying to get to treatment center, it's a long process. And sometimes I've seen people where I personally have helped and try to get them the supports they need. Have asked other people to help them to try to get the supports they need. And the system is doing what it can do. I guess frontline workers, and I give credit. I realize that. And this is why I say we have a crisis going on with addictions, mental health. And I keep saying a crisis. And if you see somebody who gets told they're going to wait 3-4 months while they're on their addiction, get them through detox and they can't. And again, I want to make it very clear that I say, I think we're in a worse, we're not going, things don't appear to me, and I'm no expert, I'm just a poor Métis with no land. And I just watch a process and watch people trying to find help. And when they do finally get the help, some of them make it, and I've watched them. And some of them come home, and we hope the supports are there for them. And sometimes some of them don't make it, and unfortunately the sad reality is we lose them. They don't make it to the treatment because they don't make the times too long. They can't see 3 or 4 months, 5 months away to get into the supports they need. When they're asking for it, it's immediate and they need that help. And I just want to share this, and then I'll let you, go ahead and answer, and maybe you guys are going to come up with a plan that can address some of this. When somebody goes through a treatment center and they get out and they've got coming supports, maybe family, friends, a mental health worker, counseling, they're doing what they can do. And then they're struggling, and all of a sudden, for some reason, they're struggling. And they need extra help right now. Maybe it's go back for a refresher. It's something they're just seeing, they're struggling, and then they're saying, I'm struggling. And they reach out to their health worker, and the health worker can only say to them, well, I'm sorry, there's nothing I can do other than maybe, see you once a week, do our session, and maybe in 3 or 4 months we can get you in again. You have to realize that sometimes that's where we're losing so many, at least that's my view of it. I mean, I can only say what I see and what I hear from people share with me, families. And we have a crisis going on, and I don't know. I'm hoping at the end of the day, government would consult, government will talk, And we see these dollars, these budgets, and I mean, I get the opportunity to come in here and talk about it. And some will say, oh, well, we're giving more money, I get it. But we see family after family, citizen after citizen, saying we're in a crisis, mental health, addictions, and suicide. So it is alarming, and I have to say, yeah, to those frontline workers, my heart goes out because, man, I don't know, and so many of them probably are burning out, and the workload must be unbelievable. And then we have problems where we see the positions not being filled, and whether it's North Battleford, you know, and I'll come back to those, a few questions I have over there, FTEs, how many we're missing and short, and, you know, the field that people are retiring, what's the plan to fulfill that? And that's, I mean, I have tons of questions I could ask because people are, you know, we're seeing problems and we're worried about it just as citizens and as, so I'll just let you, and I did, I kind of not sticking to my point because I think I want to express a little bit of the frustration from families, people struggling and hoping government will respond and your ministry will respond. And, you know, for the record, want to get on that I have shared people's concerns and views as best I can articulate what they were expressing with me. Very emotional sometimes and struggling with their own mental health, their own addictions, and they're asking for help. And there's only so much we can do in my area where, you know, I look at it. So with that, I'll leave it at that, and I'll come back to some more questions without having a whole conversation. So with that, I'll just leave with you. Thank you, Mr. Chair.
Thank you, Mr. Chair, and I thank the member for raising the question here, and maybe just talk a little bit about some of the investments that have been made over the past number of years, and where we're going here in terms of additional investments when it comes to addictions treatment, and specifically, I guess, to the member's question about access to treatment beds itself, and then you know, the wraparound supports that might be needed for individuals as well, depending on their circumstances. It's just, you know, the overall consultation that has happened and continues to happen in the years and months ahead. So in the budget, we do have a significant investment this year into additional new addictions treatment spaces in Saskatchewan. So as the member will know, we've talked about adding an additional 150 treatment spaces across the province over the next 3 years. And in this year's budget, we have $2.1 million set aside specifically for the first year of the new addictions treatment spaces to be funded in the current budget year to add capacity into the system, because we know that is a challenge. And that's something that we've heard, and that's part of the consultations, the feedback we hear from people across this province, individuals, communities, those that are in this field and providing very, very valuable work, providing the addictions treatment and support, and very, very intensive treatment. A lot has changed over the past number of decades in terms of what we're faced with and what we're dealing with, not just in this province, in every province and territory across the nation is dealing with these increasing addictions concerns, I would argue. So we want to make sure that we are expanding capacity. We know there are some groups and organizations that are already in this area when it comes to treatment capacity in a private form. We've gone through and done a market sounding approach here earlier this winter to get the lay of the land in terms of what's currently potentially out there for expanded capacity that we could partner with, but also where there might be some organizations that might be interested in getting into this field and providing this very valuable treatment support. And so we're going to be making some decisions on that in the months ahead with respect to the funding that we have set aside in this year's budget, and looking at where do we need the spaces geographically in the province, because we know that there are probably areas of Saskatchewan that aren't served as much as they would like when it comes to access to treatment. So we're going to continue to do that and roll that plan out. The consultation also leads us to, why we've expanded into a number of different areas when it comes to enhanced harm reduction in Saskatchewan over the last number of years, adding more take-home naloxone kits in pharmacies across this province, and further funding to further expand that very valuable program in this province in the years ahead. When it comes to take-home naloxone, we've had over 29,000 kits have been distributed across the province since it was instituted in November of 2015, and a significant number in just the past year, over 13,000 take-home naloxone kits distributed in 2021-22. And by the statistics we have, we know that over 7,100 kits, I should say, 7,100 naloxone kits have been used to reverse an overdose. So, that's an example of where the consultation has led to some enhancements to existing addictions supports and treatments and harm reduction. We've expanded into drug checking strips across this province, and that's a fairly recent initiative. We consult with groups like the Saskatoon Tribal Council, who we fund for. We provide some funding on an annual basis for harm reduction and support and street outreach, and the excellent work that Saskatoon Tribal Council does serving their member First Nations. We have a number of rapid access to addictions medicine clinics, 4 of them in the province operating now. Prince Albert, Saskatoon, and Regina, and North Battleford just began operations here just in the past week or so. That has also opened. And I'll maybe touch on just a little bit on pre and post treatment beds, and then I'll ask one of our officials to come up and provide some additional details in this regard. But we've added an additional 50 pre and post treatment beds in this province, and we're getting into some areas where we didn't have treatment beds before, such as in St. Joseph's. In Estevan, we now have a dozen beds there. Lloydminster, we have a dozen beds operating there at the Residence in Recovery. CBO, Oxford House in Saskatoon previously did not have any pre or post-treatment beds, now has 10. Pine Lodge in Regina up to 18, and the YWCA in Prince Albert has added 8 pre and post-treatment beds, a combination, but getting us up to a total of 87. So, but between those enhancements plus the additional 150 treatment spaces that we're going to be adding over the next 3 years, and then the expansion of the RAM clinics, those are some of the areas where we've provided some additional options and more access, greater access to support when it comes to that. And then maybe before I'll ask Brad Havervold to come back up and maybe just talk a little bit further about this. But I think it's also important to acknowledge a number of community-based organizations that are out there offering this service without any government dollars, that are doing this on their own accord and have been doing it for a number of years and sometimes decades. You know, a person comes to mind, or a group that comes to mind is, you know, Alcoholics Anonymous, for example. And there's a number of these support groups that exist around the province. I've had a chance to meet with some of them one-on-one, and they might only be operating in a community or two, but they've found an area where they've taken some initiative on their own to create a wraparound support for people that might be exiting treatment, whether it's for alcohol or you know, serious drug addictions, and they've come to the fore and are offering that support in those communities and are doing it on their own accord and are doing that very, very well, and they exist across this province. But maybe I'll ask Brad to come back up and just to answer or provide a bit more detail into this area as well.
Hi. Just to build on what Minister Hindley was speaking about, the rapid access to addictions medicine clinics. I think the minister mentioned the communities where they're operational at this point. Those really are intended to be a first stop for an individual, often who has experienced an overdose, from the emergency department are redirected to we call them RAM clinics. That consists of a physician with some expertise and training in addictions medicine, as well as nurses and other support workers. And the intent is to provide access to them to specialized care at the time where they probably feel they're in a situation where they want to make a change in their life. And so it is really an opportunity, particularly with people that are suffering from opioid use disorder, to be able to direct them to things like opioid substitution therapy or other treatments. A few other investments that have been made over the years that are in the addiction space, particularly those that find themselves in a crisis situation. We've added addictions workers into the emergency departments in Prince Albert, Regina, and Saskatoon. So there is an addictions worker in-house in the ER 16 hours a day in those communities. And again, the intent and purpose of those positions is to make the connection with the individual who's suffering from addiction concerns and to help navigate them off into the appropriate services that they need and to support them. And that was an investment from 2021 that is implemented in Regina and Saskatoon, and they're just in the process of hiring in Prince Albert. I think, as the minister mentioned, around mental health issues, often individuals don't need to go to the most highly skilled addictions medicine physician to be able to get the care and support they need. And we've implemented a training program for physicians, nurse practitioners, other primary care providers to learn more about how to better support and treat people with addictions in their own practice. Many of them would not have had much experience in addictions medicine, and this training program gives them the skills that they have that allows them to better support people within their own practice rather than referring them to a specialist or to a specialty clinic. And that's been a well-subscribed program from both family physicians and nurse practitioners across the province. The other thing I might mention related to this is the supports for the detox centers that serve individuals doing their detox from crystal meth. They often have very severe symptoms as they withdraw, and they need nurses and other people to help administer medication and support them. And so we've implemented again in 2021 additional medical supports in detox, and I believe L'Orange was one of the first communities to implement that service to ensure that the people receive the appropriate care in the detox facility that they're in, and again try to navigate them to the appropriate service.
I guess, I've got a number of questions, and I guess if you want to have time later, Mr. Chair, if the Minister with his officials wants to table some of these items and give us the numbers later, I'm okay with that. I got a few places I would like to comment because I know my time's running out and my colleague would like to go, and I have a few things I'll finish up. So if you're okay with that, I'll give them, and if you're willing to get those numbers for the committee at a later date, when it works and you get those numbers, I'd appreciate it. I guess my first one would be, how many people are currently waiting on the list for residential treatment centers facility in our major centers? Like, it's nice to know how many people are actually waiting to get into them, a treatment center. Another area where I'll just share with you, I'd also like to know how many are waiting on the detox in our major centers. And I know that some of the smaller centers, the rural, come and feed into the bigger centers because they have the facilities to accommodate that. So those are numbers I would like to see if you could give to the committee later. Would be very helpful when we're looking at the numbers. There's one that maybe your officials would have this now, but if not, they could table it later yourself or your officials. If you're willing to do that, I'm okay with that. How many children and youth in the mild to moderate categories are waiting for an initial outpatient's mental health appointment today in Regina, Saskatoon, Prince Albert, Yorkton, and North Battleford? It'd be nice to have those numbers if you could provide that. And this, well,
Thank you, Mr. Chair. We're checking here. I'm not sure if we have the specific numbers that the member opposite is looking for, so we'll try to see if we can track that that down. But I'd ask one of our officials here just to talk a little bit further about some of the youth outpatient tracking that we do have in terms of numbers and benchmarks and those sorts of things, just to relate back to the committee some of the statistics we do have on hand when it comes to treating children and youth in this province on mental health issues.
Thank you, Minister. Good afternoon. Billy Jo Morissette, Assistant Deputy Minister with the Ministry of Health. As the Minister mentioned, we don't have with us today the number of individuals waiting for those types of services, but we do track the amount of times that we're meeting our service benchmarks for child and youth outpatient mental health services across the province, and I have those which I can share with you today. So the numbers I'll share with you today are the percentage of clients seen within triage benchmarks for child and youth outpatient mental health services, and this would be for 21-22 for the first 3 quarters of the year. So for very severe, our benchmark is to see those patients within 24 hours, and we are meeting that target 86% of the time across the province. For the severe, the benchmark would be to see them within 5 working days, and we are meeting that target 94% of the time. For moderate patients, the benchmark is to see them within 20 working days, and we are meeting that target 99% of the time. And finally, for mild, the target would be to see them within 30 working days, and we are meeting that 100% of the time. And this, again, is for child and youth outpatient mental health services.
Okay, thank you for that information. And those other numbers you can get later would be much appreciated. I guess one more question I have. How many patients have left the emergency room with mental health concerns and did not see a physician? Do you have any numbers of how many patients might have left?
Thank you, Mr. Chair. Just in checking with our officials here, we track the number of patients that leave without being seen. We don't have that we don't have the actual numbers here though with us today, so we're going to try to get that. But we don't have or track specifically, is my understanding, the reasons for why a patient may have left without being seen when presenting to a hospital or an ER or whatever it happens to be. So so we do track it. We don't have the numbers. We're going to see if we can find that for you. Okay.
Thank you. I guess the other area here, I'm going to conclude my remarks, but I know the federal government is looking at, I know, mental health addictions, and I know I'm going to do everything I can to talk to certain individuals to put pressure, and maybe it's time we talk about partnerships. Maybe it's some other partners who would love to take part in the federal government and trying to deal, especially when I talk about as Indigenous people, as my grandchildren, First Nations, or Métis, there's more of a push to say we need to make sure we're doing all we can with facilities that we operate and trying to help and trying to target. So I know there's going to be a push, and I'm going to do all I can. You say you are open to suggestions and meeting, and I'm glad you feel that way, and I think that's important to have a good dialogue and talk. I'm going to do all I can and continue to advocate for people so we don't lose more lives. Families don't have to suffer the loss of barriers. I just want to say this. I'm hoping that you'll reconsider as a minister in your government safe consumption sites in Regina, Saskatoon. Unfortunately, again, we're not in this budget, and do such great work. And yes, there's many organizations that you acknowledge yourself saying are doing some work out there and on their own, and that's fine and dandy. And I do appreciate anytime we can help someone and save a life. It's important. But I'm hoping your government will reconsider, and I guess I'm asking you, would you and are you thinking of planning to reconsider looking at safe consumption sites to fund those organizations? Because they do such great work, and you talk about saving lives, and you talk about kits, and that's how important it is, not only at home. I carry one in my pocket of my coat that I always have for a reason, and exactly that reason, to make sure we can do all we can should we come upon somebody. I've lost a nephew to an overdose. That's the sad reality of life as it is, and my family's had to go through its grieving, but we're always thinking of helping someone else should we. So I'll leave that with you on the maybe for your consideration, and I've said about the federal government. The last thing I'll say, I will be approaching you as a minister for mental health and addictions. I have a suggestion I'm going to propose to you. I won't be doing it here. I'll sit down with you. We'll have a talk. And, I think there's truly some work that needs to be done. We have a crisis going on, and everybody's saying it. I think frontline workers, I'm sure your staff, your officials all know this stuff. It's not new what I'm saying to them. They all know it. I know that. And I do appreciate, I like to criticize because sometimes it's what you feel we need to do to wake up people. But sometimes I hope people realize I'm sincere and with most respect saying we're losing people. We're losing our children. We're losing our grandchildren. We're losing family members throughout the province. It's not just Indigenous, not just North. It's rural, it's urban, it's everywhere. And we have a crisis going on, especially with COVID the way it is. And I'm just going to say, I'll do what I can do to help out and advocate as best I can, with what I have, the tools that the Creator has given me to try to advocate for people. I will try to do that, and will continue to do that. So some days we'll have good dialogue. Someday I want to kick at you to say, come on, help me out here, help these families. So with that, I'll just say, Mr. Chair, thank you for giving me an opportunity to take part in some of the information and trying to find out where things are moving in a good way and where things are a crisis and we need to move further. So with that, I'll say thank you to to everyone, your officials, to the ministers, and to the committee and the chair. Thank you for giving me this opportunity.
Mr. Vermette, Mr. Love, the floor is yours.
Thanks, Mr. Chair. I'll jump back into our discussion from last week on care for seniors. Last week we had a discussion about the number of geriatricians on the job in the province, and at that time it was reported that there are 3 registered geriatricians. One of them is currently on leave. And I'm wondering if you can tell me, I thought of these questions after the discussion, what happened to the one geriatrician that we lost? Was that an unexpected loss or resignation? Was it a retirement on schedule with what the ministry expected? And were there any geriatricians that were reassigned within the healthcare system during the Delta wave, or who continue to be reassigned or redeployed?
Max Hendricks, Deputy Minister. So we had told you there was one on, there were 3. One was on leave. She's on a temporary maternity leave and will be back in the near future. The one that you're referring to, I believe, who is part-time, it was working on the modeling project with the COVID pandemic, and we believe she has returned to clinical work 0.6 FTEs now, and she was in a leadership position before, so that was her clinical assignment prior to this.
So that the 3 individuals, the 3 certified individuals, other than the one you just mentioned, are they full-time permanent? So you said that she's a 0.6 in her geriatric practice. Are the other 2 full-time? Well, I guess the one that's on leave, when she comes back, will that be full-time?
Yes, the other 2 are full-time, and the last one that I mentioned, who has leadership responsibilities, is 0.6 clinical.
I'm wondering if you can provide numbers for the committee on the outbreak. The current outbreak reporting is a little bit confusing when we get the numbers each week, because I believe it's the number of new outbreaks. So it's hard to know how that adds up. Can you provide the number of outbreaks and the number of deaths in long-term care and personal care homes since January 1st of this year and since February 28th when all public health measures were dropped?
Thank you, Mr. Chair. To the members' question here, we don't have, and we just did some searching there, but we don't have the numbers there specific to that time frame of outbreaks and deaths in long-term care since January 1st of this year or since February 28th. But I think at the last meeting that we had here, there were some questions just about long-term care outbreaks, and we do have some information overall since the start of the pandemic, so I'd just like to report those numbers back because I don't think we provided that information last time. But there were 258 confirmed COVID outbreaks in long-term care facilities notified to the Ministry of Health between March 2020 and April 2nd of this year, 2022. And there were 223 COVID-related deaths in long-term care residents between March of 2020 and March 13th of 2022.
Is it possible to get the answer to my previous question tabled for the committee, specifically the number of outbreaks and deaths related to COVID in long-term care and personal care homes since January 1st and also since February 28th when all public health measures were dropped? Can that be tabled? I can move on while they decide if this can be tabled or not. I guess for the minister, and I'm not sure this takes any discussion, but without this information, readily available to you, there's a lot of discussion about the role of personal responsibility and risk assessment, but as a minister, you're not just responsible for yourself. You assume responsibility for seniors within care of our public health system in Saskatchewan and long-term care and personal care homes. So without that information, how do you make risk assessment for those folks in care without knowing how many outbreaks or deaths have occurred since all public health measures were dropped? In other words, what information do you look at in determining if measures need to be brought back, if there's anything that needs to change? What information would you consider?
Thank you, Mr. Chair. When it comes to making these, these decisions, yes, we look at the numbers that we get in our weekly epidemiology reports that come to us, and continue to brief regularly with Dr. Shahab, the province's Chief Medical Health Officer. And we ask him when we do have these regular briefings and discussions with him, as he's watching the situation, of course, very, very closely in terms of overall in the province, but specifically when it comes to long-term care. And that's a question that I ask on a regular basis when we have these discussions with officials about, in terms of the numbers that are reported on a weekly basis, but also in terms of, are there any specific areas of concern? So that is, one of the areas or topics of discussion that we discuss and have, and have some conversations about in terms of where we're at when it comes to these weekly trends, and are there any areas of specific concern, and so make those decisions, trying to do that, and as we have done throughout the pandemic, trying to balance that advice and that we get from Dr. Shahab and from the officials, but also what we're hearing from families and residents in long-term care across Saskatchewan in terms of what their point of view is and their level of comfort is with where things are at. We've prioritized vaccinations, continue to do so for our seniors and across this province when it comes to making sure that they're fully protected, but also balancing their request to me personally when it comes to what they're looking for their own personal and mental health when it comes to being able to have visits with family and friends, and being able to leave facilities for day outings and those sorts of things. I'd also point out that local medical health officers, they still have the ability to implement local outbreak precautions, while again trying to balance the need and desire of residents, while also protecting those that are in long-term care, and knowing, of course, that it's a fluctuating resident base in long-term care as well. That's what we look to. That's how we determine, and make the decisions that are made through, again, a consultation with our province's Chief Medical Health Officer, watching all of the trends across the province. That includes long-term care and watching specific regions to see what's happening in different areas of the province, and basing those decisions on all of those factors as we continue to navigate through this living with COVID period.
So it's interesting, Minister. I'm looking at a Leader Post article that was from about 1 month ago, March 13th, and they reported that at that time the government had data available that 57 people had died from COVID-19 in long-term care homes alone, not including personal care. And one of the interesting things that struck me in this was that A, that the data was readily available for the media, and B, that the government continued at this time to separate deaths in long-term care by the categories of for-profit facilities, third-party nonprofit, and facilities owned by the SHA. And though at the time it was 10 deaths in for-profit, 5 in third-party and 4 or affiliate homes, and 42 in SHA-owned homes. What struck me about that was that the government continues to use the designation of for-profit facilities. So can you update the committee on where things are at with the 5 extended care facilities, if the government still considers them, is extended care still generating profit from Saskatchewan? Where are things at with the co-management agreement? How much is in the budget this year to facilitate transfer of those facilities? Is there any plan? I'm sure that you can interpret my question as kind of overall. Can you please give us an update on what's happening with the 5 extended care facilities for which you indicated this province would be ending their relationship with extended care months ago?
Thank you, Mr. Chair. And I'll just provide some opening comments here, and then we'll ask the interim CEO of the Saskatchewan Health Authority, Andrew Will, to talk a little bit further about the situation. What I can say to the members is that the discussions are continuing between the SHA and Extendicare in terms of the transition, and Andrew might be able to speak a little bit about that in terms of where things stand. The co-management agreement is still in place and still in effect. We still have, as I understand it, we still have staff involved in each of the facilities as part of that, and we continue to work towards, or the SHA, I should say, continues to work towards negotiating that. You know, there's a number of areas there that, and key items that require detailed review and negotiation as part of this process, which includes the service to the residents of these 5 facilities, the transition of staff with respect to their collective agreements and other matters there as well. So again, it's my understanding the discussions that are still happening, continue to take place, and maybe ask the interim CEO of the SHA to speak a bit further about current status.
Thank you. Andrew Will, Interim CEO with the Saskatchewan Health Authority. As the Minister said, we're actively in discussions with Extendicare to work through the details of the transition. I'll say the discussions are going well. Both parties are keen to see a good transition of services from Extendicare over to the Saskatchewan Health Authority. Certainly there's lots to consider in terms of a smooth transition, including the transition of staff over and some of the labor relations considerations with respect to that. So all is going well, and parties are working through the details. We couldn't speak to the details of that yet until it's resolved, but making good progress.
Is the province, the Ministry of the SHA, is it likely that you're looking at moving from co-management into ownership of these facilities? And being older facilities, which obviously was one of the causes of the outbreaks and the tragedies that unfolded, what is the future of these 5 facilities in Saskatchewan?
Yeah, Mr. Chair, it's we're not going to speculate on what the outcome of this might be. This is again a process that's underway. It's going to take some time. So how this where this ends and where this lands at the end of the process, I just don't think it's fair to speculate on what that might be.
Are there any other for-profit providers of long-term care, Canadian companies, that you have engaged in conversation with, either for these facilities or for new facilities in the province?
Thank you, Mr. Chair. As part of the, and this would be encompassed in part of it, but as part of the replacement of long-term care beds in the city of Regina, the 600 beds replacement project there has been a market sounding that's been conducted or is being conducted right now. That particular process underway. So there could be any number of organizations that or companies that may have responded to that or participated in that market sounding process. So and that would be happening as part of the the process that's underway to look at the replacement of the 600 beds here in Regina. So there could be a number of companies that perhaps that have responded to that particular market sounding and expressed an interest in that area.
Okay, thanks, Minister. Just a quick question about the Ministry of Health's pilot project focused on a new inspection program for long-term care homes. I believe that it started with 20 homes inspected by the end of March. Can you update the committee on when you expect these inspections to be happening in every long-term care facility, as was the recommendation of the Ombudsman?
Thank you, Mr. Chair. So, yeah, the Ministry of Health launched the new inspection program for long-term care homes in this past December. The initial series of inspections, which was 20 homes, was to be completed just recently, just by the end of March of this year, March 2022, with the goal that as we move forward, that all long-term care homes will be regularly inspected on a 3-year cycle. And I'll just maybe ask Billy Joe Morissette to provide some additional, more detailed and specifics when it comes to where we're at and where we are going forward with the new long-term care home inspection process.
Thanks, Ministers. So as the Minister mentioned, we had started with a smaller number of homes just so that we could really, we called it a pilot, but it was really just to make sure that, we had a good system of inspections. We were working with the homes in terms of making sure that the process was really strong. So we have completed most of the first tranche of homes, and we are adjusting our processes just a little bit as we go into the next series of homes. We will inspect them regularly on a 3-year process, as the Minister mentioned, but I do want to flag also that if there are concerns coming forward or if there are follow-ups that we find during the inspection of the home, certainly we would be able to go sooner, or we would make more than one visit in terms of that cycle. And so we are now looking to sort out where we'll be going next in terms of that next series of homes. And we'd consider a number of different factors in terms of which ones we'd want to do next, a mix of urban and rural, and, some where we might be seeing some indicators that would suggest we might want to go see what's happening in the home. I think certainly we're happy with how the process is going. And I think the homes have been quite welcoming when we get there. And there's been a really good back and forth with the homes in terms of, making this a really important learning experience and making sure that where we're finding things, there are, systems of follow-up and other processes in place.
I imagine I only have time for one more question, so I'm going to lump a few things together here and just ask for a couple, high-level comments on them. It's about the home in Laurent. I believe this was originally promised to be built in the 22-23 year, but now I believe it's projected for 2025. I'm wondering if you give an update on the timeline, who will be paying for furniture, fixtures, equipment, and also what the plan is to staff the facility. My understanding that they currently have an acute care center with about 30 beds, and they're struggling to keep and retain staff, and I'm wondering what the site-specific plan is to have more staff when they're already struggling with the facility that they have.
Thank you, Mr. Chair, and I'll provide a bit of information and ask the officials to fill in some of the blanks here. Scheduled completion date is 2025, early 2025, I believe. You know, there's some challenges when it comes to construction in that particular area because of the muskeg. Of course, there's only certain times of the year that construction can take place. But you know, we continue to be in contact with community leaders and the community as a whole in terms of this project and the significance and the importance that it is to La Ronge and area. And I'll just maybe touch on the staffing a little bit. All of our new builds that are either currently underway or will be in the near future, and that would be the Meadow Lake long-term care facility, which is set to open very soon. La Ronge, Grenfell, Estevan, Watson, any of these communities, we're going to be replacing hospitals in Yorkton and Weyburn as well, and those are all priorities for us, and it's part of why we're focusing on it through our overall health and human resources strategy, the 4-point plan that we've talked about in terms of training, recruiting, incentivizing, and retaining individuals, not just in existing facilities, but in cases where we're building new facilities and replacing them, and perhaps there might be more patients or residents that are taken care of and additional staff required. So that's why we're taking this targeted approach to looking at not just the short term, but the longer term needs when it comes to healthcare facilities in this province. But I'll just maybe ask the officials to touch a little bit on some of the other things that are happening with respect to the La Ronge project.
Thanks, Minister. Maybe just a couple of follow-on comments just around timing and schedule. So the facility is substantially designed, so we're kind of at the very end stages of design, just working through a couple of last details there. And then we are now into looking for when we can begin site works and construction. There is some, specific issues in this part of the world around when you can do certain kinds of site works and things like muskeg, and sometimes it's better to do that when it's frozen. And so we are looking, to make best use of those seasonal features, if you will, in terms of construction. And so we are hoping, to start some of that here into the fall. So I think things are progressing quite well in terms of design and getting that construction and site work underway. With respect to the FF&E and some of the local share contributions, so normally in a community we would ask the community to contribute, as we've talked about before, 20% toward the facility, and then 100% of the FF&E. In this case, government has waived the 20%, just given some of the unique features of who this building will be serving. And so we have been in early discussions with the community around the FF&E costs, and looking to come up with strategies around how best to address that with the community. Certainly it's on their radar, but there are some challenges in that part of the world that we'll have to be conscious of. But those discussions are underway, and we are hoping to really start advancing that, given that we've got a 2025 move-in timeline, and we need to get planning underway.
You, having reached our agreed time for consideration of these estimates, we will adjourn consideration of these estimates and supplementary estimates. Number 2 for the Ministry of Health. I would ask that a member move a motion of adjournment. Mr. Myers has moved. All agreed? Carried. This committee stands adjourned until Tuesday, April 12th at 3:15 p.m. Thank you.